What's been known as the opioid epidemic has misled many Americans to believe prescription painkillers alone are causing the hundreds of thousands of deaths. But as it turns out, it may not be as black and white as it appears. RT correspondent Natasha Sweet is at the FDA headquarters and has more insight into what's really going on.
The Food and Drug Administration is known for regulating medicine, ensuring that the dosage is safe to take. And now, during the opioid epidemic, some say that the government is coming in between the doctor and the patient. The results? Some patients say that they're suffering, others even committing suicide.
My mother told me I'd pay for it. She did. She said, "You played too hard and too rough." You know, my first knee surgery was at 17.
Stephen L. Hooper Sr. felt terrible back pain at an early age from playing football, lacrosse, and wrestling.
I thought everybody had back pain when you ran and did everything. I thought, you know, it's just part of it.
16 knee surgeries later, Hooper then began experiencing chronic cluster headaches.
The cluster headache, to me, what it feels like is if you had a railroad spike, and it's a big spike, I don't know if a big steel spike, and you heated it up cherry red. If you rammed that in my eye, and then you took a hammer and started banging it.
Hooper was on high doses of pain medication, up to 380 milligrams of Oxycontin and 100 milligrams of methadone a day. Even after deciding to lower the dosage on his own, after new opioid regulations came into effect in 2016, patients like Hooper had a hard time getting the bare minimum to get through the day.
I can't shower every day. It hurts too much.
Sydney Damrosch also experiences severe chronic pain from a handful of conditions.
I have Addison's disease. I have severe scoliosis, degenerative disc disease. I have diabetes, and I have neuropathy from the diabetes.
Damrosch's initial doctor was raided by the DEA last April and has been having a hard time finding a doctor to prescribe even half of her previous dosage.
Quite frankly, I think there's a lot of chaos going on.
Dr. Nicholas Scotto, a physician specializing in addiction and psychiatry, Damrosch's psychiatrist, says he's witnessed other doctors getting raided for just trying to help their patients who genuinely have pain.
I think people that are on opiates, you know, in the general public are lumped into one category.
In fact, the Centers for Disease Control and Prevention combine prescription opioid deaths with illegal opiates like heroin. Take a look at this graph from the National Institute of Health. You can see the number of people killed from all opioids, including heroin, was 30,000 people. But the number from actual prescription deaths was almost half at 17,000. And when those overdoses happened, more times than not, it was a result of mixing the prescription with 6 other pills. For those just trying to manage their pain, not mixing pills to get high used to rely on their doctors for a prescription. But now some are turning to pills from the street, thinking it's the same as what their doctor used to prescribe. Unfortunately, some are laced with fentanyl. And Dr. Scotto says the numbers don't lie. Since the restrictions have gone into effect, overdoses have increased 14.8%.
Some of them go and wind up buying opiates on the street, which is very dangerous, and you know they'll wind up overdosing and dying. And I've in fact know of a patient who that's happened to.
But overdosing from unregulated opioids isn't the only issue. Some who can't get prescriptions from their doctor are in so much pain, they're committing suicide.
There have been, you know, multiple stories of people that have suicided rather than live their life in pain.
One of my friends was really scared this morning because she was going to see her pain management doctor, and she has said before that she can't live like this anymore. And she would commit suicide if they try and take her medicine away.
At one of Damrosch's low points, she realized she too needed to talk to others going through a similar chronic pain journey.
One day I was sitting on my bed and I was just crying and thinking, you know, is this it? I'm old and worn out. Do I get thrown out with the trash?
That's when Damrosch found an advocacy group who call themselves the Pain Warriors. They're now working with delegates in Congress. Their hope is to get legislation passed to lessen the regulations for those with chronic pain. There are at least 17 states that restrict opioid prescriptions and reportedly more to come. The question is, will these restrictions actually help those who are in pain, or will these people turn to street-related opioid pain medications that could possibly threaten their life? In Maryland, Natasha Sweet, RT.
For more, we are joined by Dr. John Dombrowski, a pain management doctor and anesthesiologist. Thank you for joining us, Dr. Dombrowski.
Thanks for having me.
Okay, so we sat and we just heard the story of people who are legitimately in pain, but due to these new regulations, all of a sudden they're having to actually suffer just to comply with their doctor's rules. Have we gone over on these issues with these regulations, or are we trying to just fix a problem by putting a Band-Aid?
Well, I think you bring up a really good point. I'm old enough to remember back in the early 80s when physicians wouldn't write opiates at all because we were worried about addiction and we were very fearful. Then we started having more and more literature, more and more research came out. You know what? These medications are safe and appropriate. And actually, if we withheld these medications from patients, we would get sued because we weren't treating pain aggressively. And unfortunately, that pendulum has swung so much we were doing it maybe too aggressively, and now we're going back in the other direction. These medications always have a role. We certainly don't want to throw the baby out with the bathwater. So we need to be cautious and cognizant, which is the patients that we're on. These patients truly have a medical illness. And if they have a medical illness, there should be medical therapies for their people.
Well, we keep hearing about this overdosing problem that we have here in the United States. Are the majority of these overdoses happening by people with their own pills, or is it the misuse of their pills, or is it somebody else who has taken their pills and are using them the wrong way?
All great questions. And so what happens with overdose is that usually it's not the patients taking their medications appropriately. It's when they start mixing medications that they shouldn't be taking or taking them not as a physician has prescribed. And there's another thing called polypharmacy. So one medication I take and the other medication I take from another doctor that I may not know about work synergistically to harm myself. Other things, and they might use other street drugs that, certainly I have no control over. And at the end of the day, the death certificate says drug overdose. But from what? I don't know what was in the patient's system. Was it my medications that I gave them legally? Did they do it aberrantly? So we really don't know. So hopefully, more and more data needs to come out in terms of really what, harmed that individual. But hopefully we won't even get there.
Well, that's the thing. You mentioned that doctors used to prescribe a lot, then they didn't prescribe. You've gone through these waves. Right now, what is in the doctor's mindset? Are they more fearful because of litigation to prescribe, so therefore they're willing to put their patients in pain, leave them in pain, rather than actually take care of them for fear of litigation?
Well, I mean, litigation, with this United States, we certainly do a lot of litigation. We're a litigious country here. But certainly there are physicians might have overprescribed. And we're finding out now more than 100 milligrams of morphine in general is more than what you need. Over than that, you start having a risk of, problems with death and everything like that. But the other thing is I want, people to leave with is that if they have chronic pain and they're seeing an internist or something like that, which are great people, and they're not getting where they need to be, think about going to a specialist. If I had a heart attack, an internist could take care of me, but I probably see the pain doctor who specifically, has this. And we have anesthesiologists who are trained to do this day in and day out.
Okay, so let's look at some alternative methods besides of just taking an opioid to reduce pain. What are some of those options?
So sure, we found out, again, anesthesiologists in the operating room, we understand that there are a lot of other medications that help with analgesia or pain relief. And these might be old-time antidepressants or anti-seizure medications, perhaps an injection, perhaps a pacemaker for pain. So there are a lot of things that we can do out there. You just need to get to the right person to get kind of the right answers.
And for that person who's watching right now and they're just in pain but not enough to actually go see a specialist, what's the best way to relieve pain?
So obviously,
non-medically, but just what's the best way?
Well, a couple of things. Obviously, if it's an acute injury, ice the area is really good. Everyone loves the heating pad. I'm not so sure that's so good, but the ice is really the best. And the other thing is that you're going to talk about, again, seeing a psychiatrist, but is cognitive behavioral therapy, relaxation technique. Let me do some deep breathing and all that, because a lot of times people with chronic pain have anxiety. Let me calm myself down. And actually, there's a great Alexa app to calm you down, so you should try that too with Alexa.
There's an app for pain, for everything, including reducing your pain.
You bet.
There's an app for you, too.
Oh, thank you.
Anytime you come on here. Thanks for joining us.
Thanks.
Hey YouTube, thanks for checking out our channel. We hope you enjoyed the video. We have tons of content for you just like this. For more of RT America's one-of-a-kind news and analysis, be sure to subscribe and never stop questioning more.